Which of the following veins is most commonly used for venipuncture? A. Basilic vein. B. Cephalic vein. C. Median cubital vein. D. Femoral vein. Answer: C. The median cubital vein is most commonly used because it is large, close to the surface, and generally lacks large surrounding nerves or arteries. The best angle for needle insertion during a routine venipuncture is A. 15 to 30 degrees. B. 45 degrees. C. 5 to 10 degrees. D. 60 degrees. Answer: A. A 15 to 30 degrees angle is ideal to successfully enter the vein without going too deep or shallow. Which of the following tubes should be drawn first in the order of draw? A. Lavender top. B. Green top. C. Light blue top. D. Yellow, SPS, top. Answer: D. According to CLSI guidelines, blood culture tubes, yellow/SPS, are drawn first to prevent contamination. Which additive is found in the lavender top tube? A. Sodium citrate. B. EDTA. C. Heparin. D. Fluoride. Answer: B. EDTA is an anticoagulant that preserves the shape of cells and inhibits platelet clumping, used in lavender tubes. What is the primary purpose of applying a tourniquet? A. Stop bleeding. B. Increase arterial pressure. C. Make veins more visible. D. Clean the skin. Answer: C. The tourniquet restricts venous blood flow, making veins easier to locate for venipuncture. Which vein is located on the thumb side of the forearm? A. Basilic vein. B. Median cubital vein. C. Cephalic vein. D. Femoral vein. Answer: C. The cephalic vein runs along the lateral, thumb, side of the forearm. What is the correct order of draw using evacuated tubes? A. Red, blue, lavender, green. B. Yellow, light blue, red, green, lavender, gray. C. Lavender, green, blue, red. D. Gray, green, blue, lavender. Answer: B. The standard order is yellow, SPS, light blue, red, green, lavender, then gray to prevent cross-contamination of additives. What is the maximum time a tourniquet should remain on the arm? A. 1 minute. B. 2 minutes. C. 3 minutes. D. 30 seconds. Answer: A. A tourniquet should not be left on longer than 1 minute to prevent hemoconcentration and discomfort. If a patient has an N4 in the left arm, where should blood be drawn? A. Left arm, above foresight. B. Left arm, below foresight. C. Right arm. D. From the fore line directly. Answer: C. Use the opposite arm when possible. Drawing near in foresight risks contamination with fore fluids. A patient has a seizure during venipuncture. What is your first action? A. Restrain the patient. B. Remove the needle and protect the patient. C. Hold the arm tightly. D. Finish the blood draw quickly. Answer: B. Always remove the needle immediately and protect the patient from injury during a seizure. What is the additive in a green top tube? A. EDTA. B. Sodium citrate. C. Heparin. D. Sodium fluoride. Answer: C. Green top tubes contain heparin, an anticoagulant used for plasma chemistry tests. How should a phlebotomist identify a conscious outpatient? A. Ask for date of birth. B. Check wristband. C. Ask them to state their full name and DOB. D. Ask the nurse. Answer: C. Always verify full name and date of birth using verbal confirmation and compare with the requisition. Why should a phlebotomist avoid the basilic vein? A. It's too small. B. It has fragile walls. C. It is near nerves and arteries. D. It is too superficial. Answer: C. The basilic vein is near major arteries and nerves, increasing the risk of complications. What is the most common complication of venipuncture? A. Nerve damage. B. Infection. C. Hematoma. D. Fainting. Answer: C. Hematomas occur when blood leaks into surrounding tissue, often due to poor technique. What does hemolysis mean? A. Destruction of white blood cells. B. Destruction of red blood cells. C. Low platelet count. D. Infection in plasma. Answer: B. Hemolysis refers to the rupture of red blood cells, which can interfere with test results. What action helps prevent hemolysis during blood collection? A. Using a small needle. B. Shaking the tube vigorously. C. Letting alcohol dry before venipuncture. D. Drawing slowly. Answer: C. Alcohol that hasn't dried can cause cell damage. Always allow it to dry fully before puncture. What is the appropriate needle gauge for routine venipuncture? A. 16 gauge. B. 21 to 22 gauge. C. 25 gauge. D. 14 gauge. Answer: B. 21 to 22 gauge needles are commonly used for adult venipuncture, balancing comfort and flow. A capillary blood sample should not be collected from which of the following? A. Ring finger. B. Earlobe. C. Heel, for infants. D. Index finger. Answer: D. The index finger has more nerve endings. Use the middle or ring finger for capillary collection. When collecting blood cultures, the most important step is A. Using a butterfly needle. B. Using an alcohol swab. C. Cleaning the site thoroughly. D. Applying the tourniquet for 2 minutes. Answer: C. Proper site disinfection is critical to avoid contaminating the sample with skin flora. What condition results from repeated venipuncture at the same site? A. Hemoconcentration. B. Phlebitis. C. Hematoma. D. Petechiae. Answer: B. Repeated trauma to a vein can cause phlebitis, inflammation of the vein. What test requires a chain of custody? A. Blood glucose. B. Point/INR. C. Drug screen. D. Blood culture. Answer: C. Drug screening must follow a legal chain of custody to ensure specimen integrity. What is the purpose of inversion after blood draw? A. To mix blood and additive. B. To remove air. C. To separate plasma. D. To clot the blood. Answer: A. Gently inverting ensures proper mixing of blood with anticoagulants or preservatives. What is the first thing a phlebotomist should do before drawing blood? A. Tie the tourniquet. B. Identify the patient. C. Select a vein. D. Put on gloves. Answer: B. Patient identification is the top priority before any procedure. What can cause a falsely prolonged PT test? A. Underfilled blue top tube. B. Overfilled tube. C. Use of EDTA tube. D. Drawing after glucose tube. Answer A. The blue top, sodium citrate, must be filled properly, 9:1 ratio, underfilling dilutes the sample. What is the proper action if a patient refuses a blood draw? A. Draw anyway. B. Document refusal and notify nurse. C. Threaten the patient. D. Leave the room quietly. Answer B. Documenting the refusal and informing the appropriate healthcare provider is required.